Hey guys, a quick heads up, this show talks about mental health issues, so consider this when deciding if and where to listen. To start off, we have to humbly ask for your forgiveness, dear listener. We know it's taken us a sinfully long time to get this episode released. Though the usual issues of scheduling and time stood in our way, ironically, also our own mental health took a toll. Lastly, we do live in a capitalist society, and though this project is unfunded and we do it for you, do consider donating for us to keep working on it, so it doesn't remain a biannual spin-off series. But now, without further ado, let's jump back in. Coming up on this episode of Get Help Berlin, we explain how the current system for public therapy is creating an underground market for licenses and get into the politics that have led us here.
Last episode, we ended with Matilde suggesting a new pathway for me to try, the 116-117 hotline. When we started making this show, we had a grand plan for this series to follow me, more or less in real time, on my journey towards finding therapy, with a hopefully happy end of me finding a placement. Scratch that. It's been months since the last episode, and so it would be very phony to keep pretending I'm still on my journey. The reality is, I'm no longer trying to find therapy, because I did find a therapist and my assurance is paying for it.
Woohoo!
No need to drag you along with me anymore. I now possess the gift of hindsight and can simply give you a step-by-step guide of how to find therapy. At least the way I did it. So if you're searching, get your pen and paper out now. We're about to tell you the magic word for getting therapy. And it's not please or thank you.
Okay, so let's recap. What was the first step?
Step 1, call the 116-117 Federal Health Hotline. I did this, clicked my way through an automated menu, and then got through to someone in Berlin. They asked my name, date of birth, address, what gender therapist I want, and then searched for someone for me. And within minutes, they found a therapist near my house and booked an appointment for me for 2 days later. They also gave me a 12-digit referral code.
Okay, and is the phone number the only thing?
Well, I did find out there's also an app that allows you to do the exact same thing. You click through the whole menu in the app, and then it does ask you for this code, though, but you can just ask the app to give it to you.
Okay, so both the phone number and the app can give you the code. A little easier to get it on the phone, but the app will eventually give it to you too.
Correct.
Okay, so then what happened? You had an appointment with a therapist close by within a couple of days.
And I went to this initial consultation, had a very nice chat with a therapist. She unfortunately didn't have capacity for me. But what she did give me is a form called PTV11. And now this is a very important document, so I'll say it again. PTV11. And this is basically a pre-diagnosis, after 50 minutes of talking to somebody. Also a recommendation for the type of therapy you should seek. If you remember from last episode, there's different types of therapy, such as psychotherapy, psychoanalysis, talk therapy, and a few other options. And it states whether therapy is urgently needed right now. And then the therapist will also tick a box to affirm that, yes, they don't have any capacity for you right now. So once you got this form, you call back 116-117, and they are now supposed to find you a placement within 4 weeks. But according to my therapist of the day, this barely ever happens.
I do think it's interesting that you said therapist of the day, because I know also from friends, you do go on a lot of Sprechstunde appointments. So these 1 hour appointments where they give you a first assessment of what's going on.
Yeah, I went to about 6 or 7.
Good. So it's basically like having therapy once a week. It's just you have to restart your story from scratch.
Yeah.
So, get a little CV
really
going.
Gotta streamline the way I present myself to a therapist.
Yeah. All right. These are my main issues. My parents did this. I don't like this about myself also.
Yeah.
Right.
And hopefully I'm on the right track with that already. What do you think?
Good. So then what did you do?
Well, next you start a spreadsheet.
Ooh, spreadsheets. Catnip for mental health.
Yes. Open that Excel. Start a spreadsheet, and first thing you enter is the time and date of your call to 116-117, where you ask them, please find me a placement within 4 weeks. And yes, you do need to write this down. They will ask you about this later. And then you start emailing a bunch of public therapists. If you can find someone this way, great. And if not, you collect them in the spreadsheet and basically start collecting rejections.
So you have to start collecting the thing that most of us try and avoid.
Yes, exactly. So you have to sort of recode the rejection into something good, you know? Every rejection, you're one step closer to getting therapy.
The rejections become little milestones in your journey. You need a lot of little rejections.
Yes, exactly.
Okay.
I love to get rejected now.
Okay, and in the end, do you only contact public therapists who have a license, or do you also contact private therapists?
Okay, so you start collecting rejections, but at the same time, even if you can't afford it, you start contacting private therapists as well.
If this seems a little bit weird, it might be because you're still missing a crucial piece of information. And that is the magic word for finding therapy in Berlin. Kostenerstattungsverfahren.
That's the cost reimbursement procedure.
Basically, if you can prove to your insurance that in your case the public system has failed and hasn't been able to provide the therapy you need, your public health insurance is legally obliged to pay for your therapy with a private therapist.
And this is what that spreadsheet is crucial for, because that is what you hand in to your health insurance to basically prove that the system has failed you. So I went ahead and emailed a good 20 public therapists, listed the date of contact, date of reply, also noted if they didn't reply to me at all, that counts as a rejection. Otherwise, the reason for rejection or a super long length of wait that they say, like, you know, if they say 6 months, then you can have a spot, that's a rejection. But basically, the more info, the better. Some called me back directly, so I spent some time on the phone as well, put it all in a spreadsheet. And at the same time, I also collected a bunch of rejections from private therapists. It turns out lots of them are also booked up, but it's not as bad as the public landscape. And so after a few rejections, I found someone willing to take me on. And that therapist really took me by the hand and helped me with the next few steps.
So what were the steps that you had to go through once this private therapist had reached out to you or had said that they had space for you? What did you have to do together with them?
Yeah, so basically, what you need to do now is contact your health insurance with the help of your therapist and then hand in a whole bunch of paperwork. I think I got an email from this therapist to help me with 11 bullet points of different things of paperwork to hand in. This includes an application form, both from you and from the therapist, the spreadsheet you made, 2 different notes from your GP, so you also need to visit your GP along the way, and a whole bunch of other papers the therapist makes for you, like a cost estimation, duration, another diagnosis, etc. So it was actually super, super helpful to be taken by the hand for this and have someone to help you through this. But the good news is most private therapists will do this for you because this is basically the main avenue of having patients other than people paying out of pocket.
Right. And it sort of showcases the issue that we're going to be discussing in today's episode, right? Why do private therapists have to go through this bureaucratic hassle and patients have to go through this mental hassle and bureaucratic hassle when there technically is a system in place to avoid all of this, right?
Exactly. This is not the ideal design for how to get therapy. It's just a workaround, really.
Okay. So what are your reflections on the process as a whole?
Well, it took me a fair amount of time, about 2 months, I think, from when I started calling 116, 117 to finding a placement. And it did really, I needed to be on the ball, right? I needed to be organized, keep the spreadsheet, follow up. And I don't think if I would have been in a worse mental state, it would have been extremely difficult to keep this up. Like, it does require a fair bit of work.
Right.
To the degree that when I got this placement, I was super proud of having achieved something, which is a bizarre emotion to have in that moment. No?
Right. And so 2 months seems to be the fast lane amount of time that we've heard, right? Last episode, Georg told us that switching his insurance took about 2 months. You know, this 116, 117 process and Kostenerstattungsverfahren took you about 2 months. So it seems that is the speedy route. I will say, if you are in crisis, there is the Berliner Krisendienst that you can always call for help and go to for help. And very often therapists in moments of crisis will open up their spare spots for you to get a preemptive 12 hours, which is what happened to me many years ago.
Emphasis on crisis, though, for these options.
That's right. Emphasis on crisis. And very often, unfortunately, those will not be long-term spots and primarily short-term help to get you through a situation.
So basically 3 options, right? Work really hard for 2 months and try to not get distracted or lost on the way or despair on the way. Be in a full-on crisis, or just fully fluke it and just find a spot somehow.
Yep. Well, or change your insurance.
Also, I want to remind you, last episode I spoke about a different path that I tried with the Berlin Institute for Psychotherapy and Psychoanalysis. You can go get an initial conversation with them as well, and then they try to place you within their system of therapists that they educate themselves. So that's a pretty straightforward path that might work for you as well. And I actually got 2 placements there, but they just didn't work out for me. For you, they might.
So basically, your version was to be hyper-organized and present and get it done
I don't know how I did
strong. And my version was have a complete mental breakdown and have them help you because they had no other choice. This is what we learned last episode. The problem is not that there aren't enough therapists, it's that there aren't enough Kassensitze or licenses to provide therapy that is covered by public health insurance to all who need it. A quick reminder here, therapists need a license within the public health insurance system to be able to invoice their services with them. Without a license, therapists have to ask their patients to pay out of pocket or to jump through many complicated hoops to get therapy covered by their insurance, like Jöran described.
Yeah, tell me about it. We reached out to the Association of Public Doctors Berlin for numbers of how many people are currently waiting for a therapy spot. They didn't give us exact numbers, but they did confirm that they've seen a sharp increase in placement requests over the last few years, especially since the beginning of the COVID pandemic. And there aren't enough seats for all of these requests.
How did this happen? Let's start off with a key word to understanding the situation we find ourselves in: the Bedarfsplanung. It's literally a plan of need, but translating it as coverage plan is probably more accurate in meaning. This Bedarfsplanung is a formal plan made to ensure sufficient health service coverage across Germany, according to the need in each region. By setting a maximum number of licenses per region, it attempts to ensure balanced healthcare coverage across Germany. This is done for all types of healthcare, not just therapy. Okay, that sounds pretty good, right?
Well, according to a therapist we interviewed for this episode, it's possible that without this license distribution, many doctors and therapists would move to urban centers, where we would then end up with an overabundance of medical coverage and gaps in rural areas. Let's have a look at a bit of the history here to understand how the coverage plan was created.
The first coverage plan for psychotherapy was made at the end of 1999. To establish a base number of licenses for the plan, the people in charge simply counted the existing number of licensed therapists across Germany in August of 1999. This number has been the basis of the coverage plan ever since.
There are a few problems with this approach. First, this plan came into effect a mere 10 months after Germany passed its psychotherapy law, which gave psychologists access to public therapy licenses. Now, before this, only medical doctors were allowed in the system. At the time the first coverage plan was made, however, many of these new therapists had not yet gotten a chance to secure their license.
Another problem was that 9 years after Germany's reunification, East Germany's mental health coverage was still much more sparse than that of the West, for a host of reasons. So the base number was much lower than the actual need for therapy across the whole of Germany. So, after this first psychotherapy law gets adopted in 1999, all those formerly excluded therapists hit the market all at once. The existing therapists, represented by the KV, who had been practicing under the existing coverage plan, became worried about their income security. Maybe the KV made sure to restrict licenses enough to ensure incomes. At least that's our theory.
Here's the real fun part though. Politicians had another concern. They feared that therapy would become too popular. Imagine that. If you offer more, people will use more, making the service very expensive for the German health system. This is when the SPD and Greens were in charge, by the way, the same government that created Hartz IV. Austerity measures were a cornerstone of their policymaking. When launching his infamous Agenda 2010 in 2003, Gerhard Schröder famously said, "We will have to cut state benefits, promote personal responsibility, and demand more personal performance from each individual."
In case this peak neoliberal bullshit babble didn't already make you turn off this episode to vomit or silently scream into a pillow, we've got more fun stuff on the way. In this next section, we'll try to explain the actors, well, the bad actors, if you will, who are pulling the strings behind the current public healthcare license system.
Bad actor number 1, Gemeinsamer Bundesausschuss. The Gemeinsamer Bundesausschuss, GBA for short, is a federal institution that decides which medical services are covered for the 73 million publicly insured people in Germany and to which extent. They decide where the money goes that the health insurances have at their disposal.
The GBA is made up of representatives of the big four of public healthcare in Germany: doctors and therapists, dentists, hospitals, and the public health insurances. Decisions are made by all of 13 people, 5 representing doctors, dentists, and hospitals, 5 representing the health insurances, and 3 impartial members, one of which heads the whole commission.
As you can see, the health insurances themselves have a very big say in deciding where this money goes. Here's who doesn't get to vote on any of it: the patients. While patient organizations can apply for changes and give their input, they are excluded from the actual decision-making process. Now let this sink in. 13 people make all the decisions for the healthcare of 73 million people, and patients don't get a real say in this at all. Even the Federal Constitutional Court has called this process undemocratic.
The leader of the GBA is a man named Josef Hecken. He has been active in regional and federal politics for the conservative CDU party since the 90s and has been the head of the GBA since 2012. He is the most powerful man in German healthcare. Josef Hecken and his 12 colleagues are responsible for creating the federal guideline for the coverage plans. These guidelines are a set of rules and regulations on how to create coverage plans, basically a how-to guide. They do not, however, create the actual coverage plans themselves. Creating these plans for psychotherapy, as well as all other types of doctors, is the job of the regional KVs. So for Berlin, that's the KV Berlin, which brings us to...
Bad actor number 2, Kassenärztliche Vereinigung. The Kassenärztliche Vereinigung, KV for short, is the association of doctors within Germany's public health system. They are the same people that run the 116-117 service that I called at the beginning of the episode. The KV is basically a lobby group pushing for doctors' interests. German law has also tasked them with making sure that the supply of health services is sufficient, appropriate, and economical. In other words, they should make sure there's enough, but only to the degree that it doesn't cost too much.
To make the coverage plans, each regional KV records and evaluates the local supply and demand of, for instance, psychotherapy. They then write the plans in agreement with the health insurances. New licenses are supposed to be added where they are needed. Regional and local differences can be taken into account, which sounds reasonable, except, well, evidently this isn't happening. Berlin got its last updated coverage plan in October 2020. According to this plan, Berlin's need for psychotherapy is more than covered. They think we have 176% of the declared need covered. Needless to say, no new licenses were given to Berlin through this planning update.
So why isn't the KV doing anything about this? An excerpt from their website gives us some ideas.
As a public corporation, KV Berlin represents the interests of its members vis-à-vis the legislature and the other players in the joint self-administration. At the same time, according to the German Social Law Book 5, the KV Berlin must ensure that outpatient care for those with statutory health insurance is sufficient, appropriate, and economical. We fulfill this mandate together with the health insurance funds.
The KV represents licensed doctors, and they are the ones deciding whether to increase the number of licenses. Now, let's have a little think here. If you increase the number of licenses available, what would that do to an individual doctor's income? Bingo! it would decrease.
We've tried very hard to get someone at the KV Berlin to talk to us about this and explain their process, but our interview requests were denied on account of them needing a lot of preparation for such an interview. We're not quite clear on how much preparation is needed to explain the basic thing that is their job. But anyways, what about the other party responsible, the public health insurances? Well, naturally, the health insurances have an interest in keeping license numbers as low as possible to save money. So that's that.
But there's another reason. Think about it. How much would a full-time therapist with a full license have to work? The insurances say it's plausible for them to see 60 patients a week. So let's do the math. 60 times 50 minutes, including 10 minutes break in between for peeing, coffee, smoking, or breathing, brings you to a 60-hour work week. And that is before you have done all of the paperwork for patients and yourself. Recording what happened in the session, filling out applications for insurances, scheduling appointments, sending emails, and so forth. Asking a therapist to work that much in a week is ludicrous and would send them straight to an institution.
So how much do therapists actually work? Some that we've spoken to say that they have half of a license, which means they have to see between 12 and 30 patients a week. Let's do the math here again. Even seeing 30 patients a week, which constitutes half of a license, you will be working more than 50 hours a week. Not even including the huge mental toll that this job carries with it. Is this the highest quality therapy we can afford? Do we need to torture therapists in order for everyone to get the help they need?
You're a fresh-faced psychotherapist out in Berlin and ready to help people who are struggling with their mental health issues. You finished your medicine or psychology degree, postgraduate work, and the state exam to get you to the finish line. You've waited the seemingly arbitrary 5 years to mature and now need the license to treat publicly insured patients.
Psychotherapist Sam, and we're using a pseudonym here, told us how you would go about getting one. It's a weird, semi-official sort of underground market. Here's why it's a mix. The KV sends you a list of psychotherapists who are due to retire, and you can get in touch with their lawyer and start the negotiations of unofficially buying their license. Even a representative from the KV confirmed this, although they wouldn't give us a full interview. You cannot officially buy a license from someone who's retiring, but you also can't legally buy their praxis with the name of their patients due to privacy laws. This is what Sam had to say about this.
In reality, what gets sold is the so-called goodwill. This is you could say, the willingness to play along with the reallocation of this license, so that the young person that tries this approach is supported and gets the license approval. Because in Berlin, all districts are closed. This means this is the only way, or almost the only way, the only realistic way for most of us to get a license.
That entails taking your agreed-upon contract to the KV committee and them asking the retiring psychotherapist if both parties have come to an agreement. How much this agreement costs you? Well, this can run between 25 to 80,000 euros, depending on if you get a half license, which would allow you to see 30 patients a week, or a full license for 30 to 60 patients a week. But the numbers have skyrocketed, and we've read of licenses selling for up to 150,000 euros in other parts of Germany. Because of 5 years of medical school, 3-year unpaid internship, and 5 years you had to wait to get to the stage was all just time you spent getting really filthy rich, right? And that 25 to 80,000 euros is on top of the lawyer fees, which you will likely be paying throughout this whole negotiation process, which might take several tries.
There are cheaper ways to do this, Sam says. Just get married to a therapist with a license or inherit one from mummy or daddy when they retire.
A person who is directly related, as in married or a child of the person, is privileged. Privileged applicants will get a license before all others. That means that in this case, it also doesn't matter if someone has made a contract of sale. If it's the son or the daughter, they will get the license, even if person B is maybe more qualified.
You can also try job sharing with an older therapist or a corporation, which will guarantee you the right to work under their license. But you risk having to pay way over the market price for it and then working a ridiculous number of hours for a very low salary.
There's also a little bit of license hogging going on, and Let this be a teaser for our next episode. Prior to 1999, every psychotherapist was given a license for free. But the 1999 law based the number of licenses on how many psychotherapists existed in their given area at that time. And no surprise, there are now more people in Germany and more psychotherapists, so they have since run out of those allotted licenses. So in essence, young psychotherapists are paying for older psychotherapists' retirement when they never paid a dime for their license back in the day.
Is this legalized corruption? Well, it's difficult to pinpoint just one reason why the structure still exists, and since we couldn't get an interview with the KV, it's also difficult to understand who exactly is fighting to keep it like this. Sam has some theories.
I mean, it is political. Who would bear the greatest risk by creating more seats? Maybe this still has something to do with the stigmatization of mental health care in the political arena.
Sam told us about going to the 2013 convention where CDU politician and head of the GBA, Josef Hecken, made this comment.
You don't need a psychotherapist for every citizen. Sometimes a bottle of beer is just as good.
Hecken's comments sparked outrage and he later apologized, but this mentality is still pretty widespread in Germany, especially amongst the older generations. According to them, Germans just don't need therapy. However, the greater need for psychotherapy has also stemmed from the fact that there's a destigmatization happening, particularly in the younger generation.
Then there are players who are benefiting monetarily from this underground market. The lawyers who negotiate the contracts between retiring psychotherapists and incoming ones buying the therapy licenses. They might have a vested interest in all of this. Plus, there are those who argue against the cost. Sam explains.
There are studies that show every euro that you invest into mental health, if we look at this purely economically, has a good return of investment. For every euro that you invest, you get a minimum of 1 to 2 euros back. It's not a net loss in the long run. But first, it'll cost a lot of money. You do have to make a starter investment because, well, the need is there. The health costs would rise. On the other hand, there are also immediate savings. This means less sick days, less conditions becoming chronic. It would pay off relatively quickly.
Yeah, the situation is depressing, which might make some people, I don't know, want to find someone to talk about it all. Well, the good news is, even with all the political mess that is keeping the number of desperately needed licenses from being increased, there is still a way that you can get your therapy sessions covered by your public health insurance. As Jöran told us, the magic word is Kostenerstattungsverfahren.
Hey folks, this is Anna Marie, the phantom voice you've heard pop up a couple times in this episode and the show's producer. I just wanted to take a quick moment to share some exciting news. We wrote a cover story. Jöran and Matilde and I teamed up with ExBerliner Magazine for their most recent cover story, and it's all on this topic. You can find a lot of the details from this episode in print in that story, plus a step-by-step guide to get your Kostenerstattungsverfahren. We hope this is helpful to you on your search for psychotherapy. Check out exberliner.com for places in town to get your copy.
So there's hope for all of us, and we encourage you to keep trying, because we all deserve the help we need. As we said at the beginning, please do consider supporting financially if you can. If not, listening is already a support. As we keep working on this process, please let us know your questions about therapy in Berlin by sending us an email at hallo@radiospätkauf.com.
Thanks for listening. Tschüssi.